Let's bring in our front bench to weigh in on that. Onward CEO and former Liberal Cabinet Minister Maryam Monsef is here. Former Communications Director to Aaron O'Toole and current Texture Communications President Melanie Paradis is as well. So is NDP strategist and Monk & Associates principal owner Kathleen Monk, as well as the Globe and Mail's Queen's Park reporter Laura Stone. Hi, everybody. Really good to see you tonight.
Hi there.
Maryam, I'll start with you. Is this just doing more of the same, as the Premier says, for a better outcome, or is it opening things up to the criticism that the opposition has levied today?
Vassy, I think it's a terrible idea. I don't think it's going to solve the problem. We've heard from professionals that it won't, that in fact, it will create other problems. What I'd like to know, given that these folks have a majority, that they've spent the last 5 years in many ways starving the public system and now further starving it, is if they were to go ahead with this, what kind of accountability and what kind of transparency can Ontarians expect? For example, who's going to own these privately run clinics? Are they Canadians? What standards are they being held to? Who's going to get paid and make money? And what kind of accountability is attached to that public investment in this private care? And second, as far as quality of care goes, which is the thing that I care most about, if my mom goes into surgery into a clinic, will she get the same or better quality of care in one of these privately run clinics than she would across the street at the publicly run hospital, or not? And how are we measuring that? And if those two things, accountability and transparency, are not baked into the deal, then those privately owned companies should not be accepting the money. But let me be clear, it's not a good idea. It's not going to solve the problem. And frankly, it's a missed opportunity to invest in wellness and public health and to diminish the demand on the system.
Some of those things, I think, Melanie, the devil will be in the details, right? We got to see how this legislation is actually written, and if a lot of that accountability, which I think is a really good point that Maryam makes, is built into it, and how transparent things are. Some of the questions are in the vein of what I put to Ontario's health minister, whose primary response was really, look, this already does exist, and it works to a certain degree. Do you think that argument flies?
Yeah, absolutely. I think that first of all, Canadians all across the country understand that our healthcare system is in shambles, and the status quo just simply isn't working. And so what Ontario has done is they're coloring completely inside the lines here. They've realized we have areas where we can make improvements right now before the deal, if it ever gets done with the federal government. We really need to see progress on that, by the way. But what they're doing is they're allowing the facilities that are already performing these surgeries, that are already doing these procedures, to just do more of them. So none of this is particularly new, and I think that most, especially Ontarians, are quite familiar with this. When I was pregnant and my doctor sent me to have my blood work done, that was at a Life Labs. That's a private facility technically. When the Prime Minister went and got his COVID booster shot and his flu shot this November, that was at a Shoppers Drug Mart. The previous vaccines he got done at Rexall. Neither of those facilities are public. Those are private facilities, but you don't pay for it. It's covered by OHIP. So really, again, like I said, they're coloring inside the lines here, and they're doing what they can within their limits.
I like the way that Melanie said that, Kathleen, because that is basically how the government says, hey, this is not that much of a change. We are not using, you're not paying out of pocket for this stuff. It's still going to be publicly funded. It's just going to be delivered in a different way.
Yeah, but there are two major problems with what Premier Ford has set out today. One, he hasn't recognized that the heart of this crisis, of our healthcare crisis, is the fact that there's a healthcare shortage. And the creation of more clinics, more private, for-profit clinics, isn't going to help that shortage at all. It's actually going to make it a lot worse. We have nurses that are currently forced to be working double, sometimes triple shifts. So what, now they're expected to take on a third shift, moonlight at a private clinic? You heard in that clip that you played before this segment, where Premier Ford said, he said the same exact doctors will be working in both locations. That just can't happen. They're already stretched too thin. So that's the first problem, is the fact that we're not addressing the shortage of healthcare workers. The second one is that it has not ruled out, nor did his minister when she spoke to you earlier in your interview, rule out the idea of for-profit clinics. So they're going to welcome those for-profit clinics. Well, headline news, people who are in for profit have the responsibility to their investors to deliver profit. They're not into maximizing the benefits for people. They're into maximizing their profits. So that means, again, we're siphoning off more money from our healthcare system. Sure, Premier Ford will say time and time again that you will only have to show your healthcare card, not your credit card. But the problem is that more money from the public system will be siphoned off. We've seen it before with with nurse agencies. We've seen it before with long-term care. When this kind of money drains the public system and gets worse outcomes.
Well, the caveat is, of course, if there are some rules around that in the legislation. I'm not saying there will be, but there could be, and certainly the opposition will raise that. Laura, this is like anytime you use the word private in healthcare, it's like boom, right? It's a huge political issue immediately. Do you think the Ford government will be able to circumvent the politics of this?
I think politics will always be at the heart of this. I mean, healthcare is sacred to Canadians, and public healthcare is sacred. And I think that you'll find from a wide variety of people, from a wide variety of political stripes, that they don't want that to go away. Of course, the argument is about how to best approach it. And you see the Conservatives here, as Melanie has mentioned, kind of broadening what they are already doing. Of course, there is a political risk here because as you say, Vassy, it's a flashpoint to talk about anything to do with private healthcare. But of course, if it yields results, I think that Canadians will also be very forgiving people. I mean, we've seen over COVID the challenges that the healthcare system has had. Kathleen talked about those staffing challenges. I think the Ford government believes this will in some way help that because it will create better working conditions if more of these surgeries are moved out to different clinics. The challenge here will be, does it work? I think you saw today healthcare groups such as the Ontario Medical Association, the Ontario Hospital Association, and some CEOs of some pretty major hospitals come out in support of this. So it is not immediately as controversial as some of the other Ford government's recent moves, such as the notwithstanding clause, for instance, and what they did there around education talks. So, this isn't immediately something that is controversial within the field, but the proof will be in the pudding, whether this does help with those wait lists, whether it does help with the conditions that we're seeing in hospitals, and whether, this is what critics fear is that kind of slippery slope that leads to more and more privatization. But I think Canadians are probably open to something that does help improve the healthcare system, at least in the short term.
Yeah, we're pretty desperate, I guess. Like you said, though, the proof will be if it actually does make a difference. And the only tangible outcome that they're promising right now is around cataract surgery. So we'll see if that changes.